The first physical therapy appointment occurs about 10 days after the ACL repair surgery. That first appointment is kind of an introduction diagnosis sort of appointment. You go in and they show you a bunch of different exercises that you will do in subsequent appointments, and they provide you with a home regimen. There are two basic components of physical therapy throughout the course of rehabilitation. The first part is flexibility and range of motion, and the second part is strength. Strength enhancement begins about 3 months into physical therapy. In the very beginning of physical therapy, right after the surgery, you're doing more range of motion. So the leg has been immobilized for 10 days, and the knee hasn't bent that much, relatively immobilized, completely immobilized the first few days, and then maybe you can bend it a little bit, resting your leg up on a pillow when you sleep at night. You're having the crutches, but really hardly bending at all. And your muscles really atrophy surprisingly quickly. So in the first physical therapy appointment, they ask you to raise your leg while laying on your back, raise your heel. They ask you to maybe turn onto your side and raise your leg up by lifting your hip. Again, your heel from the table while laying on your side. They may introduce some stretching, some flexible rubber bands that they place around your feet and you pull on to stretch. And it's really about just introducing flexibility. And then they will, at the end of about an hour, they will put electrodes on your knee. 4 electrodes. They call this Russian electro shock therapy treatment. Something to that effect. There are 4 little electrodes in a little machine, and they place it basically where the incision sites are, 4 of them, around your knee, so that they form, so that the currents will run diagonally between one and the other, intersecting right over your knee. And so these electrodes are increased to a certain level, and they will help with the healing process and help with pain, and they'll just pulse electricity for about 15 minutes. Not painful, but an interesting sensation. And while they're doing that, they rest a bag of ice on top of your knee, sometimes with a towel in between your skin and the bag of ice. From there, you go home. You're supposed to do physical therapy twice a day, every day, lifting your legs, stretching, doing a whole regimen, and they'll run through it with you and provide different pictures of what you're doing so that you can remember what your regimen is, and maybe they'll send you home with a little rubber band as well. In terms of, for some stretching exercises, I ended up using the rope that wraps around my terry cloth bathrobe, the thing that tightens your bathrobe. I pulled that out and used that to wrap around my legs so that I can stretch and pull as they directed me. Over the course of the first month or so, this increases, and the routine changes as you become more flexible and better at regaining motion in your knee. They'll have you balancing the leg, doing dips, moving left and right, putting rubber bands over both of your knees, and then having you kind of sidestep along a line. They'll have you put a rubber band around your ankle and move your leg back and turn and side. And so they'll have a variety of different activities for you that'll continue to evolve every 2 weeks or so. And about 3 months into it, they began doing more dynamic strength training. So this entails leg presses, jumping, jogging on the treadmill. About 2 months in, they have you do the exercise bike or so. So fairly steady progression to regain range of motion and strength, so that you can return to the physical activities that you originally were doing prior to the injury. So it is a bit of a workout, and you got to bring your tennis shoes and your shorts and a t-shirt because you do work out and there are weights there. It is supervised weight training in a way. And then, of course, the important part is doing physical therapy at home. And you have to get creative because they give you assignments with equipment that they have there that you may not have at home. So if you're lifting dumbbells and doing squats and you don't have any dumbbells at home, then you can use a jug of milk. If you don't have a swivel chair, I use a little swivel ottoman I use to pull myself across the floor. And I often would maybe turn on the TV and just lay on the couch and do my stretches, which they can range in time. The whole routine can take an hour and a half, or they may just give you homework at the beginning, especially that lasts about 10 minutes each. So you're doing about 20 minutes a day of physical therapy, and then it increases over time as you gain more flexibility and strength. So that's pretty much the extent of physical therapy, and it's just about being in it for the long haul, doing the homework on the days when you're not in the clinic to do the physical therapy, and making sure that when you're there you have the right posture and technique, and again, ultimately, you are the beneficiary of this physical therapy. One piece of advice everyone gave me was make sure you do your physical therapy. It's very tempting, especially once you start regaining your motion, to just stop doing the physical therapy or to not do it as much or as well or as hard. And really, now and during the healing process is the time to regain your motion. And in fact, in addition to all the exercises, every time I visit the physical therapist, at the end of my session, they would sit me down and they would take some like hand cream and they'd place it over my scars, and they would massage the scars to try to separate the scars from the tissue underneath the skin, to try to gain more flexibility in my skin as well. So when you're doing the physical therapy, you're really setting your body up for returning to normal activities in your life for the rest of your life. And any skimping that you do with your physical therapy will hamper you and your abilities to perform in athletic endeavors to a similar extent that you were able to perform prior to your injury. So I highly recommend adhering to your physical therapy regimen.